Hi, good morning. My name is Anjanette Mikumpalapura, and for today, I am your nurse one for this return demonstration, which is complete bed bath and skin and hair hygiene.
And hello everyone, my name is Riza Emarasigan and I will be your nurse.
I'm Precious Jessica P. Pablo and I am a nurse 3.
And I am Jeanine Deloria, assistant nurse.
I am John Vincent Lasaleta. I am a assistant nurse.
And I am John Lawrence Laguna, the patient.
Hi, I'm Maria Gina Kaitina and I'm your assistant nurse.
And hello everyone, I am Nelia Rose Mondiar, the video recorder and the editor.
Good day everyone, my name is James A. Morales and I am the presenter of the group.
And we are the Group C.
Let's move on to the procedure. Following the procedure help us execute the proper demonstration of bathing and skin care. For procedure number 1, review chart for any limitation in physical activity. For the step 2, bring necessary equipment to the bedside stand or overbed table. Step 3, perform hand hygiene and put the gloves and other PPE as indicated. Step 4, identify the patient, discuss procedure with the patient, and assist the patient's ability to assist in bathing process, as well as personal hygiene and preference. For the step 5, close curtains around bed and close doors to the room if possible. Adjust the room temperature if necessary. Remove sequential compression devices and anti-embolism stocking from lower extremities according to the agency protocol. Step 7, offer a patient's bedpan or urinal. Step 8, remove gloves and perform hand hygiene. Step 9, adjust the bed to the comfortable working height, usually elbow height of the caregiver. Step 10. Put on gloves, lower side well near to you, and assist patient to the side of the bed where you will work. Have the patient lie on his or her back. 7 is loosen top covers and remove all except the top sheet. Place the bath blanket over the patient and then remove the top sheet while the patient holds a bath blanket in place. If linen is to be reused, fold it over the chair. Place soiled linen in laundry bag. Take care to prevent linen from coming in contact with the clothing. Step 12. Remove the patient's gown and keep the bath blanket in place. If the patient has an IV line and is not wearing a gown with snap sleeves, remove gown from the other arm first. Lower the IV container and place gown over the tubing in the container. Rehang the container and check the drip rate. 3 side rails. Fill basin with a sufficient amount of comfortable warm water, 100 to 115 Fahrenheit. Add the skin cleanser and if appropriate, according to the manufacturer directions. Change as necessary throughout the bath. Lower side rail closer to you when you return to the bedside to begin the bath. Step 14. Put on gloves if necessary. Fold the wash clothes like meat on your hands so that there are no loose ends. Step 15. Lay a towel across the patient's chest and on the top of the bath blanket. Step 16. With no cleanser in the wash clothes, wipe one eye from the inner part of the eye, near to the nose, to the outer part. Bath. Step 17. Bathe the patient's face, neck, and ears. Apply appropriate emollient. Step 18. Expose the patient's forearm and place the towel lengthwise under it. Using firm strokes, wash hands, arm, and axilla, lifting the arm as necessary to access the axillary region. Rinse if necessary, and dry. Apply appropriate emollient. Procedure number 19. Place a folded towel on the bed next to the patient's hand and put the basin on it. Soak the patient's hand in the basin. Wash, rinse if necessary, and dry your hands. Apply appropriate emollient. Step 20. Repeat actions 15 and 16 for the arm near you. An option for the shorter nurse or one prone to the back strain might be to bathe one side of the patient and remove to the other side of the bed and to complete the bath. Procedure number 21. Spread a towel across the patient's chest, lower bath blanket to the patient's umbilical area, wash, rinse if necessary, and dry chest. Keep the chest covered with a towel between the wash and rinse. Pay special attention to the folds of the skin under the breast. Step 22. Lower bath blanket to the perineal area. Place a towel over the patient's chest. Step 23. Wash, rinse if necessary, and dry abdomen. Careful inspect and clean the umbilical area. Step 24. Return the bath blanket to its original position and expose the far leg. Place the towel under far leg. Using firm strokes, wash, rinse if necessary, and dry leg from ankle to knee and knee to groin. Apply appropriate emollient. Step 25. Wash, rinse if necessary, and dry the foot. Pay particular attention to the areas between your toes. Apply appropriate emollient. Step 26. Repeat actions 24 and 25 for the other leg and foot. Step 27. Make sure the patient is covered with a bath blanket. Change water and washcloth at this point of earlier if necessary. For the step 28, assess patients to prone of side lying position. Put on gloves if not applied earlier. Position bath blanket and towel to expose only the back and the buttocks. Step 30, if not contraindicated, give the patient a back rub. Back massage may be given also after perineal care. Apply appropriate emollient and or skin barrier product. For step 31, raise the side rail, refill basin with clean water. Discard washcloth and towel, remove gloves and put on clean gloves. Step 32, clean perineal area of the set-up patient so that or she can complete perineal self-care. If the patient is unable, lower the side rail and complete perineal care. Following guideline in the chapter text, apply skin barrier as is indicated, raise the side rail, remove gloves, and perform a hand hygiene. Step 33, help the patient put a clean gown and assist with the use of other personal toiletries. Step 33, help the patient put a clean gown and assist with the use of other personal toiletries such as deodorant or cosmetics. Step 34, protect the pillow with a towel and groom the patient's hair. For the step 35, when finished, make sure the patient is comfortable with the side rails up and the bed in the lowest position. For the last step, change bed linings, dispose of soiled linings according to agency policy, remove gloves and any other PPE. If used, perform hand hygiene. That's all. Thank you. Now let's move on to the procedure. Step 1. Identify the patient's two identifiers. Example, name and birth, or name and medical record number, according to the agency policy. Procedure number 2. Determine whether a physician or order is needed before a shampoo can be given. For this procedure number 3, assess activity tolerance of the client, check the existence of the scalp problem. For step number 4, assemble equipment and supplies, then bring them to the client's unit. Procedure number 5, explain to the client what you are going to do, why it is necessary, and how he can help. For procedure number 6, provide for client's privacy. For procedure number 7, assist the patient to the side of the bed from which you will work. For procedure number 8, arrange the equipment. Put the plastic sheet on the bed under the head and cover it with a drew sheet or bath towel. Place Kelly pad over the bath towel and let it and extend it to the receptacle or pail. If Kelly pad is not available, improvise a through. Place newspaper on the floor under the pail. All other articles are placed in the bedside table. Procedure number 9. Put a folded washcloth or towel where the client's neck rests on the Kelly pad. Tuck another bath towel over the chest and around the client's shoulder. For procedure number 11, protect the client's eyes and ears. Place washcloths over the client's eyes. Place cotton balls in the client's ears. Procedure number 12, shampoo the hair. Gently comb the hair well, observing scalp and hair for color, texture, distribution, scaling, infestation, or infection. Wet the hair thoroughly with warm water, directing waters away from the eyes and ears. Place a small amount of shampoo into the hands, working it into a lather and massage into the scalp and hair. Apply conditioner if prepared by the patient. Rinse the hair thoroughly. Squeeze as much water as possible out of the hair with your hands. Procedure number 10. Fan fold the top bedding down to the waist and cover the upper part of the clients with a bath blanket. For procedure 13, pat dry hair with a bath towel and wrap turban style. Remove Kelly pad to brush sheet and position body. For procedure 14, remove cotton balls from ears and discard properly. Dry ears, forehead, and neck. Continue rubbing hair and scalp gently until dry. Comb and arrange the hair using a clean brush or comb. For the step 16, ensure client's comfort. Remove bath blanket. Encourage the client's clothing it in place. For step 17, dispose or clean equipment and return it to the supply room. Perform hand washing. For the last step, document pertinent data.